My name is Holly Chignoli. I am the Associate Director of Nursing Evidence-Based Practice and Standards at The Ohio State University Wexner Medical Center. One thing that I really loved about nursing is just the flexibility in the field. So you can be a bedside nurse for your career, you can go on and work in academia, you can work in administration. There's just so many opportunities. When I was in the master's program and I spent some time with nurse practitioners, I spent some time with physicians, and I just felt like I got such a great experience with my clinicals throughout my program that I felt like when I graduated I was really prepared and I knew what I really loved. I worked at the convenience care clinics for about 10 years. I also spent about a year or so working at the travel clinic. I worked at the COVID swab stations as the clinical lead. I always have that love of learning and continuing to grow. While I was working as a nurse practitioner, I got the opportunity to attend the EVP full immersion for a week, and that was just such a wonderful experience. So it was a really great way to connect the College of Nursing with the medical center and really getting more involved with the medical center leaders in nursing. I really gained so much knowledge and so much excitement for evidence-based practice that I went right back to my clinic and started thinking about things that maybe we could do differently or things that we needed to look more at the evidence to make sure that what we were doing was best practice. So after that, I ended up applying for the Doctor of Nursing practice at Ohio State. And one thing that I really loved was that I felt like it really supported a work-life balance. It was great because there were opportunities for online classes, evening hours. Professors just always seemed to be available and warm and willing to help. And with your classmates, you really just develop this camaraderie or team feeling. So I think just going through those 7 steps of EVP and just learning that process has just made it so that I can teach that every day. Hearing staff nurses, leaders saying that, what does the evidence say? So I think just ingraining that in our culture is so important, and that's really been a huge impact on patient care and making sure that we're providing that best care to our patients that's based on evidence. I don't know what's on the horizon, but based on my experiences over these past 18 or so years in nursing and all the different experiences I've had, that I just kind of feel like anything is possible.